Hi everyone, we're doing a presentation on the Certified Registered Nurse Anesthetist, also known as the CRNAs. I'm Christy.
I'm Deanna.
I'm Katie.
CRNAs are pretty much advanced practice registered nurses with graduate level of education and provide anesthetics to patients in every patient setting for every type of surgery or procedure there is out there. We pretty much decided to do CRNA because we all have a goal of getting a master's or just a graduate level of education in nursing, and we're possibly considering to do CRNA because we've all either worked with CRNAs in the past or have known some really great CRNAs and are definitely interested, and especially with the high CRNAs that are high in demand in our country these days, because in order to work in a surgical setting, you must have a graduate level of nursing. And according to Mayo Clinic, more than 44,000 CRNAs exceeds availability. And requirements and qualifications. In order to apply to a CRNA school, you must have 1 year of full-time experience in a critical care setting, which I thought it was 2, but it's actually 1. And then must graduate with a minimum of a master's degree from a nurse anesthesia educational program. And it must be accredited by the Council on Accreditation of Nurse Anesthesia Educational Programs. And then once you're in the program, you must pass the national certification examination following graduation. I'm sorry.
I'm Deanna, and I'm here to give you just some brief ideas of what to expect for job responsibilities for the CRNA. They develop and implement and evaluate the anesthetic plan of care for the patient. They recognize emergent situations and respond rapidly and appropriately. In situations like that, for example, succinylcholine for intubation purposes, they have to be aware of malignant hypothermia and what could happen and how to correct it expeditiously. They also implement and evaluate response to critical and acute pain management techniques. They are discharge patients and educate them on the follow-up after anesthesia care, what to expect, what could become of it, different things like that. They act as liaisons between various departments, such as surgery, obstetrics, the PACU, the ICU, and pharmacy, and they collaborate with physicians regarding the treatment plans and the anesthesia efficacy. They maintain patient safety during the treatment, and they follow strict infection control policies and procedures. The scope of practice for a CRNA does not vary. It has a lot of different aspects to it, but I'm just going to give you a few. First of all, they perform and document the pre-anesthetic assessment and evaluation of the patient, which includes requesting consultations and diagnostic studies. They select, obtain, and they order, as well as administer the pre-anesthetic medications and fluids, and obtain informed consent for anesthesia, which is very important. They develop and implement an anesthetic plan based on that particular patient's care. They initiate the anesthetic technique, which may include general, regional, local, and of course sedation, which I mentioned to you earlier for succinylcholine. They select, apply, and insert appropriate non-invasive as well as invasive monitoring modalities for continuous evaluation of the patient's status. And they also manage the patient's airway and their pulmonary status using the current practice modalities, which is very important. A few agencies and organizations for the CRNA are the American Association of Nurse Anesthetics, also American Society of Regional Anesthesia and Pain Medicine. There is also the International Student Journal of Nurse Anesthesia, as well as American Society for Peri-Anesthesia Nursing. You can apply to one or you can have all, but those are just a few organizations, societies, and agencies.
I'm Katie, and I am going to talk to you about the impact of the CRNA on the nursing profession. We're going to start with the nursing shortage, and what they look at when they're looking at a nursing shortage is the estimates of vacancies in the hospitals and the ambulatory care centers. They use national data and they use state-by-state data. The predictors of the future regarding these vacancies is on the training of the CRNA rates versus the retirement rates. and the future projections of that are that we will see an increase in CRNAs, but however, those vacancies in the ambulatory surgical centers will decrease because of the incentives. They will not decrease in the hospitals unless the hospitals offer the same incentives as the ambulatory care centers. Nursing care outcomes. Because of rapid operating turnover and short recovery room stays, insight into the patient satisfaction with anesthesia care is often lost and not reliable. So you want to look at best practices. What is the optimal outcome of that patient? Are they getting quality pre-evaluation? Are their needs being met? You want to look at patient satisfaction. Did they have a good experience, or was for some reason their experience not so good? Did they have issues, concerns? Current practices include implication. Are CRNAs not only giving good, excellent technical care, but are they engaging the patient emotionally? And the future considerations of this is, are the CRNAs being trained effectively to provide patient satisfaction? The CRNAs is part of a solution to the healthcare reform. Research shows that certified registered nurse anesthetists are the most cost-effective providers. You want to look at the preserves provider non-discrimination language that states that healthcare facilities cannot discriminate based on the licensure of the professional providing the care. Support removal of barriers to the use of the CRNA services states that the CRNA can practice autonomously, that they don't need to be under the direction of an anesthesiologist or a physician. And you want to look at the support innovative models of the healthcare delivery, which those models push for the CRNAs to have autonomy because that is the most cost-effective route to go. Healthcare economics, you're looking at cost effectiveness, the care of the CRNA versus the anesthesiologist, and CRNAs and anesthesiologists perform the same care. There's not really any different. They are trained, they just have different degrees. The tasks performed are the same. They both provide anesthesia care to patients in the outpatient setting and in the hospital setting. The pay of the CRNA versus the anesthesiologist. CRNAs are usually salaried. There's not a compensation lag, and they usually don't get overtime, where the anesthesiologist is usually paid by the hour. They do have a compensation lag, and they do obtain overtime. You want to look at evidence-based practice. Evidence-based practice is taking the best available research, patient preferences, and clinical expertise and make judgments about the best action to take care of that. It is not just simply knowing and implementing current guidelines. The steps in the process are to, ask questions, ask that patient what's going on, if they have any questions, if they have any concerns, if they've had anesthesia before, do the research, review and assess what's going on, integrate those results, and then come to a conclusion that you can give your patient the best quality care during that procedure. The legal issues that come along with the CRNA is what is called captain of the ship doctrine, which is basically the doctrine that CRNAs cannot practice autonomously, that they have to be under the direction of a physician or an anesthesiologist. This has been a debate for a long time. Physicians feel that they don't want that because of the legal ramifications. So new laws have been put into place for what is called an opt-out law, where state by state they can choose to let that CRNA practice autonomously. There is constantly new research being conducted, and one of the legal issues is billing concerns, how they bill, because formerly they used to bill under the anesthesiologist, now that CRNAs are practicing autonomously, they have to readjust the billing. Quality of care. You're looking at the background. For the longest time, anesthesiologists held the belief that they provided superior care over a nurse anesthetist, but through study of data and methods, data sources, analysis methods, really the results have shown that CRNAs can provide the same quality of care that an anesthesiologist. They perform the same task. So in overall, CRNAs provide the same quality of care at a cost-effective rate, and so please look into wanting to be a CRNA. Thank you very much.
Back again, I am Deanna. This is Katie and Christy. I think I have those backwards, but that's okay too. We just wanted to take this time to thank you for watching us for our presentation for CRNA, and we hope that we gave you enough information for you to look into researching to be a CRNA. It's a wonderful experience. It's a great career, and we hope that we helped you make this decision. Thank you again.
All right, bye.
Bye.